The Division of State Fire Marshal is one of 7 divisions within the Ohio Department of Commerce.
After this short training, you will be able to identify Special Study Number 9244 developed by the United States Fire Administration and its purpose. Identify and recognize what each code in Special Study 9244 means and how it will be used within your incident report. Recognize infers fields during the pandemic that you will be using. Recognize how to use the Fire Service Casualty Module to record exposures to the coronavirus. On March 26, 2020, the United States Fire Administration's National Fire Data Center implemented Special Study Number 9244, COVID-19 was a factor in this incident. This special study is to collect information regarding incidents that occurred with a factor present relating to the COVID-19 pandemic. You can access this special study in your Infer software. If you do not see this special study in your software within the basic module, please contact your software vendor and they will provide you with an update. This COVID-19 special study is being used to discover specific call volumes and types related to the COVID-19 pandemic. This is a national level collection of data, which means that all states and fire departments that participate in infers are asked to fill out the subsequent COVID-19 special study information. The start date for this study has been predated to January 1st of 2020. What this means for individual fire departments is we would like you to go back in time and code any incidents that have occurred since January 1st of 2020 and fill out the special study information. We understand that this could be a large number of incidents, but it is important at the minimum to include special study information in incidents in which COVID-19 was a factor. We're going to explore what that statement means in just a moment. The end date for this study is December 31st of 2022, and the study will continue for a total of 3 years. Once you choose the special study in your software, you will have 4 choices of values. 1. Yes, COVID-19 was suspected. 2. Yes, COVID-19 was confirmed. 3. No, COVID-19 was not a factor. 4. Unknown. Let's look at each of these options individually. Number 1. Yes, COVID-19 was suspected. If you believe but have no confirmation the occupants or participants of the incident have COVID-19, or if you believe that COVID-19 and the current climate of the pandemic could have caused the incident to occur, then you would choose this option. During this time of teleworking, there are more families working from home. Adults and children alike are doing work on laptops, tablets, and others have lost jobs because of business closures and are trying to weather out the pandemic. Whatever the dynamic is, families are doing things a little different from the normal. With good questioning, we hope you can decide if this incident would have happened in the normal climate or if it happened in the wake of the pandemic and lifestyle changes mandated to minimize the spread of the virus. The word suspected in this slide simply means you suspect that COVID-19 was a factor contributing to this incident. Number 2. Yes, COVID-19 was confirmed. If there's a confirmation of the coronavirus diagnosis on occupants or participants in the incident, or the current condition of the pandemic were definitely a factor in this incident, and the incident, in the absence of COVID-19, would not have occurred, then choose number 2. Number 3. No. COVID-19 was not a factor. Regardless of the pandemic condition in the state and nation, the incident would have still happened, and no one on the incident was suspected of having the coronavirus. Number 4. Unknown. Anyone who has taken an OFERS data class from me knows how much I absolutely love the unknowns and others. The unknown should only be chosen when there is absolutely no evidence to suggest, one way or the other, that COVID-19 was a factor in this incident. You cannot tell if the incident would have occurred in the current climate of this pandemic, and you have no way of knowing or suspecting that anybody on the scene would have had the coronavirus. A few thoughts to think of. When you respond to an incident, ask yourself several questions. Did someone on the scene have the coronavirus, or do you suspect that they may have had it? Do you think this call would have happened if the pandemic did not? And lastly, would this call have happened if the nation were in a normal operational status pre-COVID-19 pandemic? This study can and should be used on all incident types. Everything from fires, medical alarms, service assignments, good intent, and false alarms, just to mention a few. The study is not limited to fires only. Let's talk about the rest of the report. In the basic module, the incident type would remain the same. The incident type is what you find when you arrive on the scene and not what you are dispatched to. You will choose the incident type that best suits the incident. Remember, don't use any 00 codes as these are series headings only. Make sure you list all apparatus and personnel in the resources section of your software. This will help you keep a good account of who was on the scene and which apparatus they responded on. This information will help in cases where there is a confirmed exposure of your firefighters. You will account for how many casualties there were on the incident also in the basic module. Remember that casualties are not only fatalities, they could be injuries as well. Civilian fire casualties are only counted if there is a fire. This injury can be from any activity relating to the fire, such as escaping from a burning residence, jumping from a window, burns related to trying to extinguish the fire, and so on. Fire service casualties, however, should be counted for any injury related to a firefighter on a scene, even if the call was not for a fire. Fire service casualties should be counted on any incident types that are listed. You have to make sure the number of casualties that you list here in the basic module match the number of casualty modules that you have completed. There should be one casualty module per injury or exposure. A fire incident report is not complete without a narrative. If COVID-19 was a factor in the incident, please identify that in the narrative or remarks portion of your report. When filling out Special Study 9244, it should typically be located at the end of the basic module, but it could vary depending on your software. Fill out the special study according to the information that we've already covered. If your software vendor needs assistance in putting on the special study, have them contact our office. In the EMS module, you can collect civilian casualties that are not related to a fire. If there was an explosion and a civilian were injured, this is a 200 series incident type because there is no sustained flame or fire. Therefore, that information cannot be placed in the civilian fire casualty module, but it can be placed in the EMS module. Remember that you should not be placing any personal protected health information in the EMS module. You can create a fire service casualty report for any firefighter who is injured on the scene. This also applies to exposures to the coronavirus. Remember that the exposure has to be identified. A firefighter wearing appropriate PPE as identified by the CDC and health departments would not be an exposure unless there was an extenuating circumstance. The number of casualties identified in the basic module must match the number of casualty modules completed. Each exposure or injury requires a separate casualty module. When you arrive at the severity question in the fire service casualty module, if the firefighter was exposed to the coronavirus, then place a 1 in the box, which stands for report only, including exposures. This is the appropriate field to choose for COVID-19 exposures. Fill out all of the fields in the fire service casualty module and remember, please complete the special studies section. With your help, we can collect valuable data that will identify specific data points in call volume and type during this pandemic. This will help us be better prepared in the wake of another pandemic or similar issue within the nation. Lessons learned from data are valuable and timeless. Help us be proactive in this time. Thank you. Thank you for what you do. Thank you for your participation in the Ohio Fire Incident Reporting System, and thank you for the wonderful job that you do at completing these incident reports. We have seen an amazing improvement in the quality of incident reporting, and this is directly related to your commitment. Lastly, thank you for being on the front lines. We appreciate everything you do and the sacrifices that you daily make to respond to incidents. We are here for you. Should you have any questions or need clarification of any of the information presented today, please feel free to contact us at your convenience. We are here to help you. We will all get through this together.